Hello and welcome to Baja Medical. The purpose of this presentation is to give you a brief overview of our stem cell therapies and treatments. Firstly, our stem cell therapies involve the implanting of stem cells into the body via intravenous or site injection. Injections are normally for joint issues. We offer various types of mesenchymal stem cells from the umbilical cord, bone marrow, or adipose fat. These stem cells can be autologous, that means they originate from the patient's own tissue, or allogenic, that means they come from a donor or from, say, an umbilical cord, an outside source, in fact. The type of cells we use and how they are administered depends on the circumstance of each patient's case, as does the period of stay. This also depends on the circumstances of the case and the condition treated. A stay can range from as few as 1 to 2 days or last for weeks. Typically, a patient stays for around 5 days. All patients are given a full medical examination upon arrival. The course of treatment also involves other treatments and techniques aimed at ameliorating and enhancing the effect of the stem cell infusion or injection. We also offer a range of other subsidiary treatments that patients can benefit from during their stay, such as physiotherapy and other alternative therapies. Our intravenous treatments are minimally invasive. We typically use cord tissue stem cells, but on occasion use bone marrow and/or cells from adipose fat. We offer the option of staying in top-rate accommodations, either in an urban or beachfront setting. Patients can also stay in specially adapted medical suites. The amount of cells infused can vary, although at this time we typically infuse hundreds of millions of cells through IVs. The state-of-the-art licensed laboratories we work with and from whom we source our cells produce huge quantities of cells through cultivating and expanding harvested cells. Cell expansion is the process of taking cells extracted from tissue, culturing them in the lab, and encouraging them to reproduce. The reproduced cells are identical to the source cells, but this process allows more effective treatment with a much greater number of cells. This increases the possibility of a positive result. Additional visits may be advised, and as a consequence, frequently patients are advised to return over time for more infusions. Well, why would you go to Mexico for stem cell therapy? Well, here's the answer. The so-called stem cell therapies on offer in the US are extremely limited in their scope. This is due to restrictive FDA regulations in the US, which severely limits what US-based stem cell clinics can do. People have been traveling to Mexico for stem cell therapy, amongst other reasons, to receive dosages of hundreds of millions of cells and thereby increase the chance of a positive result. For more information on our protocols and conditions treated, do not hesitate to consult our website at www.stem-cells-mexico.com, or better still, give us a call on +1 619 344 0565. We will be happy to answer any and all of your inquiries.